Hello, welcome to today's presentation, Choosing the Right Care, presented by Dr. Chet Morrison, Surgeon and Trauma Medical Director for Washington Health. Dr. Morrison has been the Trauma Medical Director for Washington Health since January of 2024. Prior to this, he was the Associate Professor of Surgery at the Central Michigan University School of Medicine and Trauma, Medical Director for St. Mary's Ascension Hospital in Saginaw, Michigan. He has 23 years of trauma surgeon experience and is board certified in surgery and surgical critical care. Please welcome Dr. Morrison.
Hello, everyone. Thank you for listening to the presentation, during which I'll be discussing injury in the context of the health services that Washington Health has to offer. As mentioned in the introduction, this is what I do. I've been doing this for a while. I like doing this and I like talking about it, and I hope that you get some information out of this that you will find useful. What we're going to be discussing in the short presentation, we'll mention that there are several layers of care, and one of the things that was notable is I was in the military, and when I was in the Army, we also had different echelons of care. And quite honestly, I did them all the way from sick call at a local clinic, all the way up to the major medical centers. And so there's various levels of care within the civilian system and also in the Washington Health system specifically. So we'll be going over them, and what I hope to do is put this in the context of acute injury. Because again, as mentioned in the introduction, that's what I do for a living, is treat acute injury. And so we'll go through some things, and again, we hope that this presentation gives you some information and the ability to make choices, and also, quite frankly, since I've been associated with this organization, lets everybody know what it is we have to offer. So what levels of care do we have to offer? Well, the very first one, we'll start off with a primary care provider. I certainly hope everybody has a good primary care provider that provides routine and ongoing care. The primary care providers are really very good for managing the chronic healthcare problems, and also as a source of information for acute care issues that patients may have. We don't really recommend them for acute injuries in general, because very often their offices aren't equipped for the acute injuries, and we have places that people can go. But one of the things that we certainly do recommend is after injury that patients inform their primary care providers or clinic. So it's known. And the primary care providers that I talk to say, yeah, at the end of it, after everyone's gone through the entire trauma cycle, it comes back to them, and they're the ones that follow the patients longer term. So that's the one level of care. Washington Health, we're fortunate now to have our own urgent care center. The urgent care basically is set up that has the ability to treat same-day, non-life-threatening issues. And because it's same day, patients can basically walk in, and they don't need to call ahead for appointments. And they're equipped to handle some of the minor slings and arrows that life gives us. For example, minor fractures and sprains are often well treated in an urgent care clinic. Minor cuts requiring stitches. Urgent care can do that, and for most people, just a suturing and cleaning of the wound is really all they need. Minor burns, same thing that life gives us, and can often be handled in an urgent care clinic, as most of them will heal. Most of them will heal without significant scarring or functional deficit. Obviously, more severe burns are going to be treated in an emergency center. And as a general rule, in terms of going to urgent care, patients basically should be the ones who they can walk and they can talk. And their symptoms shouldn't be of the sort that we really, really worry about. So you might be walking and talking and yet have severe chest pain and running down your arm and a history of heart disease and so forth. And obviously for that, you would want to go to more of an emergency setting. Yet on the other hand, when you accidentally cut yourself or get fishhook injuries or things like that, as well as minor infections, the urgent care really does that very well. Turning up to the emergency room, which we have at Washington Health, and I'll just briefly summarize the statistics. You can look at them, but ER visits are actually very common. Actually, when you throw in poisonings and overdose, it's really a lot of people who come there. Almost like half of us in any given year go to an ED. And that means that that's a lot of people. Actually, a lot of them result in hospital admissions. It's not the majority. But when you factor it out, about 17.8 million hospital visits come from the ED. And some of those, in fact, even go to our critical care unit. And that's like over 3 million. The ED, this statistic, and this is national-wide, this is from the national summary tables, the percent of visits with patients seen in fewer than 15 minutes is 40%, which actually I interpret as something that's very, very good because, again, look at the first number. The EDs are very crowded by a number of patients, and the fact that they can actually get that figure up to 46% is very commendable. Also, the ED has a triage system, some of which in trauma I'll be getting to in a few minutes, that allows them to see the most injured and more critical patients first. So that's how they work. And because of the fact that they can be the pipeline to the hospital or the operating room or critical care unit, we do recommend that for the more serious and life-threatening symptoms and injuries, that the patients come in to there. One of the ones, again, that this is what I do for a living, is severe trauma or uncontrolled bleeding. Bleeding is something that needs to be addressed as soon as possible. And all the thing about the emergency rooms, including ours, is that they're equipped to stop bleeding, and they have the equipment to stop bleeding relatively quickly, which is what you want to do. Obviously, chest pain or difficulty breathing I had already alluded to. That's actually a good symptom to go to the emergency room. The stroke symptoms and loss of consciousness are also another good symptom that goes to the emergency room. And I would add, of those last two bullet points, the chest pain and the stroke symptoms, that there's a direct relationship between outcome and how quick you're treated. So if you're having a heart attack, the quicker you get treated, the more heart muscle you'll save. And so the EDs are set up to get treatment as quick as possible. Similarly, just within my clinical lifetime, we've actually gotten very good at treating strokes and getting blood flow back to the brain. So the stroke symptoms should be promptly gone to the emergency department. And again, the ED is set up so that when we think someone's coming in with a stroke, we already have the machinery in place to get treatment quickly. Severe allergic reactions, of course, also are, obviously, I suppose, time-sensitive things, which also merit ED admission. And so when in doubt, when one is having symptoms and there is some doubt as to which level of healthcare you should choose, I would say the following principles apply. For symptoms that are severe or the worsening, we do recommend choosing the ER because some of those severe or worsening symptoms may in fact be life-threatening, and the ED is equipped to treat them. I'd said in the beginning of the first level being one's primary care provider, we do know that primary care providers are the primary source of information for the majority of patients. And so calling the primary care provider of the office for guidance when unsure is often effective, particularly when the office is open and when one has a relationship with one's primary care provider. They know who you are and they know what other medical issues you may have. I will mention that urgent care is often faster and it's quite effective for minor issues. So if the issues are minor, then that's actually a very good place to go. And, as I say to my patients, not only when they have something acute, but when they're recovering from injury or from surgery, trust your instincts and listen to your body. It usually tells you where to go. And the fact serious symptoms need immediate care, and more minor symptoms actually can be very well handled at the urgent care. Thank you very much for your attention.
Thank you, Dr. Morrison. We do have a couple of questions. The first question is, or statement is that if I were not feeling well and I call my primary care provider and they had no appointments available, what would my next step be? Urgent care or ED?
I would recommend, for the most part, I would recommend urgent care. And the reason that I would do that is because the majority of illnesses, not only are they somewhat self-limiting, but they'll respond to fairly straightforward treatment, particularly if you don't have any other significant long-term conditions you're battling for. The other thing that I kind of wanted to stress, I sort of touched on in the presentation, is that each level can refer up. So An urgent care, if they look at you and they think that you're sick enough that you may require hospitalization and emergency services, they'll send you there. So just like the ED, if a severely injured patient comes in, they'll notify the trauma team. So I think that's a good place to start. Now again, bear in mind the symptoms that I mentioned earlier. Things like I can't breathe, I'm losing consciousness, I'm fainting, I'm bleeding, I'm having incredible chest pain, I'm having the worst headache of my life. When people say I have the worst blank of my life, then you start thinking more in terms of, ED visits.
Okay, that's good. And then also, most urgent cares aren't open 24 hours. So if you have, a trip and fall, but you don't really feel like you need to go to the emergency room, but the urgent care is not open, is the ED still a good option?
It's an option. And then, you have sort of the decision that I've seen people make both ways. You can wait till the next day when the urgent care does open, or you can go to the emergency room. And that's kind of the bullet I put on one of the slides about when in doubt. If you feel that this can probably wait till tomorrow, it probably can wait till tomorrow. If you feel that it can't wait till tomorrow, then I think you should go to the EDs, which, obviously, as we know, have the benefit of being opened on a 24-hour basis and always staffed. And, late at night, I find that patients who come in late at night tend to be more along the ones who need ED services. Because the instinct is, if you're not feeling well, to just sort of go to bed and hope you wake up feeling better the next day. When that doesn't work, then they come into the emergency room. We get a lot of our acute care surgery cases that way. So again, it's an individual decision. I think it's based on how you feel. And one thing I tell my patients when they're recovering from surgery or injury or something is listen to your body. Your body tells you how you're feeling.
Very good. Very good answer. Also, I wanted to point out your when in doubt. When in doubt is a great statement to make. You're at home, you're not feeling well, but you're just not sure. If you're in doubt, go to the your local emergency room.
Yeah,
right.
That would be my thing. I
Okay.
could have titled the presentation that.
It's very good. Well, thank you very much, Dr. Morrison, for this insightful presentation. This concludes our program, and thank you, viewers, for tuning in. The entire broadcast of today's presentation will be available on YouTube.